Joshua Choi, who is the infectious disease and MAT care coordinator supervisor at the Los Angeles Christian Health Centers. Um, um, he has been working on this for quite some time. He's a graduate of Johns Hopkins University, and we look forward to his sharing his experiences from the LA Christian Health Centers. Joshua?
Thank you so much. Let me just share my screen here. Let's see. Okay, it looks like there's a technical issue on my end. So, Lindsay, would you be able to share the screen from here? Thank you so much. So I first wanted to explain kind of the role that I have, the infectious disease and MNT care coordinator supervisor. So basically what I do is I am a particular designated coordinator for HIV, HCV, and as well as in some cases syphilis, as well as a coordinator for patients undergoing MAT care. So today I'll talk about kind of our overall hepatitis C program, as well as something that we call focused care coordination, as well as the strategies that we've utilized in our screening and linkage. Next slide, please. And I have no particular disclosures. Next slide. And so when we talk about Hep C care in vulnerable populations, for us particularly, it's in the Skid Row community in Los Angeles. There are a few things that may come to mind, and I've listed a few here that are particularly important when we're talking about vulnerable populations. So the first is robust HCV screening, linkage, and treatment. The second is follow-up that is coordinated, consistent, and intentional. And finally, we have a rapport building and trauma-informed care that is crucial in order to engage well with these populations. Next slide, please. And so to provide a bit of an overview of our organization, again, we're the LA Christian Health Centers. We're an FQHC that is based in Los Angeles. We have two main clinics, one in Skid Row and another in East LA. We have 7 satellite clinics and 4 street medicine teams that are located throughout the greater LA area. And that amounts to around 13,000 patients cared for each year and around 70,000 medical visits. Next slide, please. And so within that is our hepatitis C program. And some of the specifications and characteristics of our program include universal HCV screening that is at all of our sites, including our brick and mortar and our street medicine sites as well. We have rapid HCV testing and field-based phlebotomy that is given right on those sites. We have low barrier access to HCV treatment, which includes primary care treatment. And we have coordinated follow-up that is engaged by the focus care coordinator. And all of these are providing care to a predominantly homeless population, unhoused people, and those who are in transitional housing or in shelters. Next slide, please. And so focus care coordination. What we mean by this is we have a dedicated hepatitis C care coordinator, which is myself, who works directly with our providers and uses a internal database that links with our electronic medical record in order to engage with patients real time. So what that looks like in our care cascade is we have antibody tests that automatically reflex to the RNA tests, and this is in brick and mortar settings. And the care coordinator receives real-time alerts of RNA positive tests that come in. And so the care coordinator meets with these patients, they educate them, and then they continue to outreach them, which includes writing letters, going to the street, home visits to see these patients. And then they continue to help these patients link to care. Next slide, please. And so in the street medicine setting, the role of the care coordinator is similar. So there is rapid point of care tests that are done, and those are received and given back to the patients in around 15 minutes or so. And we have confirmatory blood draws that are given right at that spot. So we have medical assistants and registered nurses that are doing those blood draws right after those positive antibody tests are seen. And the care coordinator meets with these patients and immediately schedules a follow-up appointment, gets necessary contact information, and meets with this patient. Then they continue to outreach to the patients as needed for follow-up, and they link these patients to care. And one thing I want to particularly note in this particular slide is uh, that in each step of the process, there is incentives that are given to the patient. So for each patient that is coming in for a rapid test, we give them McDonald's sandwiches, we give them hygiene kits and snack bags in order to have them test. And from there, we have tap cards. So that is for public transportation that we give them if they do a blood draw. And then once they come into their appointment, we have gift cards that are available for the patients that come in as well. Next slide, please. And so some of the strategies that have helped us with our linkage, I have listed here. So first is the co-localization of HCV services. So we co-localize our screening to places that are highly utilized by our patients. So that can be homeless shelters, that could be places that have Medicaid-assisted treatment or residential facilities. Another is hugely our street medicine program, which enables us to go to where the patients are. Not only are we having patients come into our clinic, we have the street medicine teams that engage with the patients in their houses. We make home visits. We have partner organizations like the People Concerned that we work with to give both housing and HCV treatment services to our patients. And we have consistent testing events. We test every week, multiple times per week, and we use our mobile van as well as our street medicine teams to engage patients with those testing. Next slide, please. And so I just wanted to highlight a few of the resources that we use as well. So for online database resources, especially when we're trying to find patients that we haven't been able to find for some time, there is HMIS Clarity. So that requires a one-day training, but after that, you'll be able to access that. And Lanes as well is, so both of these are online resources that have patient information, the last visits. If they went to a different hospital, you can access all of that information through these databases, as well as just another thing that has been helpful is to give patients prepaid phones as well, especially for patients who are higher risk, to be able to provide those phones to have a reliable way of contacting them has been very helpful as well. Next slide, please. So these are just some examples of how we've gone to where the patients are. On the left, we have our mobile van in which we test our patients. And on the right is just an example of a street medicine encounter where you don't need a mobile van, you don't need all of this equipment, but just a medical backpack and desire to want to go and see them is all you need as well in those settings. Next slide, please. So just to give a little bit of the data for our screening. So these are the numbers of tests that we were able to do each month. And for the year of 2023, we were able to do 3,095 antibody tests. And among those, we had around 150 patients that were RNA positive. So that yields a positivity rate of around 5%. Next slide, please. And so among those patients that were positive, we were able to link 133 of them, which yields a linkage rate of around 89.3%. Next slide, please. So kind of to give a longer term screening statistic. So this is from December of 2020 all the way until the most recent March of 2024. We were able to complete 7,566 tests, And among those, we had 373 confirmed positives. And we were able to link 300 out of 348 patients. And that discrepancy is just patients that transitioned out of care and everything. So that yields a linkage rate of around 86.2%. Next slide, please. So out of the experiences that we've had, what have we found that works? So we found, as many people have indicated today, that scaling up screening and treatment to those areas that are highly utilized by patients is something that is very helpful. And also another thing that we found is bundling HCV treatments with other types of services is something that is very helpful as well. So we bundle our care with mental health, with social work, with dental services all in one place in our clinic. And so when patients come in for these other types of services, that gives us another opportunity for us as the care coordinator to engage and link with the patient, as well as giving the patients another incentive to come in to the clinic to receive treatment as well. So as I mentioned, dedicated care coordination, focused care coordination has been crucial to ensure that patients progress through each step of the care cascade, and to provide them with resources and anything that they need to be successful in their treatment. And also universal screening through one-time HCV testing that's in both clinic and on the street has been very important as well. And HCV treatment at the primary care level. So we have currently 7 primary care treaters that are able to treat for HCV in our clinic and in the different satellite clinics that we have. So that has been extremely important to help that low barrier access for treatment for these patients. And so also we have found that these questions are some that have been helpful to ensure that the patients are set up for success for the treatment. So are they motivated? Do the patients want to be treated? And are we able to be patient and have that patience to wait for our patients so that they can be treated when they are ready? Second is accessibility. So is HCV treatment easily accessible? Is it in the primary care level that we can provide that kind of treatment? And do the patients feel safe? Do they have a safe place to store their medications? And for us, that has meant providing medication lockers for the patients to be able to put their medication in a place that is safe that they can access. Support. Does the patient have a support system? And do they have even a case manager that may be able to be a support system for them as well? And do they have contact? Those prepaid phones are definitely important in this aspect as well, where we have that reliable way to contact our patients. Next slide, please. So what more is needed? So further focused patient navigation. So if we were able to have care coordinators specific for hepatitis C on the county level or in different areas where hepatitis C treatment is given, that would greatly elevate the success rate and the amount of patients that we are able to see and treat. So that is something that is highly recommended. Another is creative screening strategies. If we were to have rapid RNA tests on the field, that would eliminate one more step that the patient needs to take in order to receive their treatment. Next slide, please. And so, yeah, I just want to acknowledge my team, my supervisor, Shannon Fernando, as well as here's my contact information. I am transitioning out of my role. The new point person who's taking over my role, her name is going to be Frida, and that's her contact right there. So if you need us to refer patients or link patients or anything, we are happy to help as well. So thank you so much.